Thank you for joining us. This is Live with Miami's Community News, and I'm Michael Miller, and our guest today is Dr. Lawrence Lesfrance from the South Gables Dental Group. Thank you very much for being here, Doctor.
Oh, you're quite welcome. Thank you for having me.
So I've known you for quite a while now, and I know that you're a Columbus graduate. So tell us about your experiences at Columbus and what happened after you finished Columbus. Where did you go to school?
Oh, Columbus is, as you guys know, a great high school down here. They have great academics, great sports, camaraderie is unbelievable, and we have formed lifelong relationships there. But it is like a good prep school for college, so I was able to go to Brown University. I played football there, so that helped also getting in, and I went with a couple of my buddies up there, and it afforded me the opportunity to get a great education at Brown. And then afterwards, I went to Emory Dental School. And because of the cold winters up in Rhode Island, after growing up down here, I'm native down here. I was born at Doctor's Hospital. So the shorts and flip-flops didn't work up there very well in the winters. But I wanted to get right back to Miami, so came down here and did a residency for 1 year at Mount Sinai. They have dental residencies after dental school, and then started practicing general dentistry since then.
Now, all the things in the world, why did you become a dentist?
Dentistry is great because it combines a lot of things. It combines biology, which was a great love of mine, and also some artwork. And we call it functional art because we make things that look pretty, make things that look great, but have to last in a very hostile environment. You have a lot of hot foods, you have a lot of hot drinks, a lot of cold things
and grinding
and a lot of forces, breaking teeth, this and that. So the materials have really excelled in the past 10, 20 years. So
let's talk about, if we could, there was an organization called the Smile Direct Club, and remember seeing those ads on TV, which was a device similar to Invisalign, to where you could just do it all by the mail. Take a picture, send it over, all right? And then they would supply a series of trays to correct your teeth.
Correct.
Something happened to this worldwide organization, all right, that had started in about half a dozen years ago, that had a lot of clients, a lot of patients, if you will. So why don't you tell us what happened and what Invisalign, who's the leader in this, is doing?
Sure. So Smile Direct Club, they actually started in 2014, was the first year, and they've done 2 million cases. And Smile Direct Club is basically a home version of Invisalign. And Invisalign, when you go to the doctor, they take either digital or physical impressions of your teeth and 3D impressions, and you send them to the company and they fabricate a whole set of aligners, but the doctor is there to guide you. They see you basically every 3 to 4 aligners, and you make sure that there's room for the teeth to move. You have to put little attachments on the teeth and all that. So Smile Direct Club is a version of that, but it was supervised by doctors, but it was all online, like telehealth, basically. And there was no physical doctor presence, so the people would do it at home. So if you had a case that was very, very crowded, you wouldn't have as good results as if you were seeing a dentist. But for minor cases, small crowding cases, something like that, very minor, where there's not a lot of rotations or crowding, it would work great. So on December 8th of 2023, they made an announcement that they were going bankrupt. They were filing Chapter 11.
That was Smile Direct.
Smile Direct Club, yes, correct. And they had this thing that they called a lifetime smile guarantee, that if your teeth ever got crooked, you could contact them and they would give you more trays. And they had a home thing to where you could do your own impression of your mouth. You bit into this putty and you would send it to the lab and they would pour it and make models and stuff like that. But the basic thing, like I said, for minor cases, it was great, but anything more advanced, it's better to have more supervision with a physical dentist to come in. And that's,
And to provide guidance, because for the most part, that's the first time people have done that themselves versus somebody with 20 years experience, you know what to look for.
Correct.
That would be tough to do that, especially something that is so apparent to everybody that we look at, all day long.
Yes.
So tell us how Invisalign is stepping in.
Yeah, so basically, like I said, on December 8th, they filed bankruptcy, and the lifetime smile guarantee was just null and void. you bought the thing, you made your payments, and then there's no more assets, there's no more service, there's no more, you can't get trays, you can't contact anybody, the company's closed.
And what was the average price you think that people paid in advance?
I really don't know, because most of the work that we did was with Invisalign, but it was in the thousands for sure, so depending on the cases. So, but what Invisalign did, they found out that they had gone bankrupt, and they sent us a notification to all the Invisalign providers like myself. And what they did was they said, okay, we know that you're in a lurch, and say your treatment is not done, not completed, or not finished, or you're just beginning your case and you already paid. So we're going to give you 50% off of Invisalign fees through Invisalign doctors if you bring your certification that you had paid, Smile Direct Club, and you fill out a form with Invisalign. And in turn, Invisalign gives the doctors a 50% discount off of the cost of the trays that are provided to the patients. So it's a win-win, because people will come in, they'll get their Invisalign done with a Invisalign certified doctor like myself, and then we'll be able to monitor the case, and they'll get 50% off, and we don't pay the full lab case.
So the frustrated patients, all right, who 6 weeks ago got a notice, sorry, we're not doing anything, there was some relief.
Correct.
Yes.
There was some relief, and Invisalign's a great company. They really stepped up to do this for people. They didn't have to do anything like that. So, but they're a great organization. Their technology just gets better and better every year.
So, Doctor, why don't you show us how Invisalign works? Yeah,
for the people that don't know about Invisalign, basically, these are some study models from Invisalign here, and this is a model of your teeth, and there's actually an Invisalign tray on here. It's clear. You wear it 22 hours a day. The only time you take it out is when you eat, so you don't get food in there and stuff. So basically, the tray fits very intimately to your teeth. It's clear. It's firm. It's a great technology because it's strong enough to put pressure on the teeth. So say you have a tooth that's out like this, and the first tray will fit that tooth. The second tray, it'll be back a little bit more. The third tray will be back a little bit more. So it moves about 0.2 millimeters per tray per movement. So it's a gentle, constant pressure on the teeth, either to rotate it, to move it forward and back, move it up or down.
So they anticipate, the dentists have put these together, they anticipate what they want, all right, what the patient wants, all right, and it's progressive. How many trays sets might there be in its course of treatment? Well,
Invisalign has different tiers. They have an express case that is, and the cost structure and the fee structure are commensurate with the cases. So they have like a 0 to 5, a 0 to 7, a 0 to 10 trays. Then you go up to a tier 0 to 14 tray, 1 to 14 trays. And then you go over that, which is called a comprehensive case. That's over 14, and that's a full case, and that can take a little longer. So basically, we change the trays out once a week. So if we're looking at a 12 case, for instance, 12 aligners, it's basically about 12 weeks plus or minus a couple weeks.
The number of trays has to do with a variety of things, which is the severity of the case or the intensity of it.
Yes.
Right? And so within, if somebody orders this, within 4, 5, 6 weeks, they're going to see a big difference.
Oh, absolutely. Yeah. Even in the first, couple of weeks, you start seeing movement, because 0.2 millimeters doesn't sound like a lot, but a tooth, the thickness of a tooth is 1.5 millimeters of enamel. So say you have the front and the back of the tooth is 3 millimeters. So after 4, 5 weeks, you've already moved it a millimeter, which is almost a third or half the thickness of a front tooth.
So besides vanity, there's some really good reasons to have your teeth correct.
Oh,
so tell us about some of those.
100%. And that's what we're taught. And we also belong to the American Academy of Clear Aligners, the AACA, and they have different study groups. And we have a great study group down here with a lot of local people in Miami, Florida. And we take advanced courses of that besides the regular Invisalign courses. And some of the benefits, one thing that they really teach is that straight teeth are clean teeth, and straight teeth are healthy teeth. So when your teeth are a lot straighter, your gum situation, your periodontal situation, what we call it in the industry, is your gums aren't bleeding. The gums don't accumulate plaque. They don't accumulate tartar in there as well. When they're a lot smoother like this, it's harder for plaque to get onto that surface. When the teeth are crooked like this, it's like a little cave, a little area for the plaque and the tartar to get in there. So the straighter your teeth, the better. So that's one thing that we talk about. Periodontal health is really important. A second thing is your bite. A lot of people have malocclusions where their teeth don't come together. They're only hitting one tooth in the front. They're hitting a tooth on the side, and they really wear that tooth down, which can lead to the tooth cracking or chipping or splitting in two. We've seen that on instances to where they only hit one side, and they'll end up breaking that tooth because the forces are not evenly dispersed. So once you have all your teeth hitting nice and evenly, you're spreading out the forces of that bite, and you're gonna set up the situation for a lot more long-lasting teeth, for your lifetime. So,
can we put up the QR code and run the website address? So, Doc, a lot of people grind their teeth, and some people are not comfortable with saying that they're grinding. They think there's something wrong, but there's really some things that people should know about grinding and what it might do to their general health. Tell us about it. What some of the short-term solutions are to that.
Well, for the grinding, because I always tell people, once you grind your teeth, the tooth structure doesn't grow back, right? So it can cause all kinds of problems. It can cause cracking of the teeth. It can cause sensitivity because once that layer of enamel's gone, you're into the next layer that's closer to the nerve. It's actually called the dentin, and has little tubules that lead to the nerve. So once that's exposed and the enamel's off of it, then they start getting sensitive teeth, either at the gum line or the top. So the more you can prevent people from removing their own enamel, the better it is. So the earlier.
And people should get a professional night guard, not just go get one off the street. They should go into a qualified dentist and say, Doc, besides everything else that I got going on, I know I grind my teeth because my jaw's hurting.
Yes, well, I was just going to touch that point. That's a great point that you brought up. A lot of people, once they start grinding, it overwhelms the musculature of the mouth. So basically, you're running a marathon every night when you're sleeping. You're just grinding your jaw back and forth. You're clenching. You're squeezing. You're using all the closing muscles of your mouth, and there's many of them in the head. There's temporalis, masseter. There's accessory muscles to position your jaw. So they get overwhelmed. The people wake up with headaches, with migraines, everything else. So the night guard basically does two things for those patients. It'll stop the teeth from grinding away, the tooth structure, but it also can give a little relief to the temporomandibular joint. So they call it temporomandibular dysfunction, TMD, and that's a popular thing for people who have pain and they can't open their mouth and they get headaches and their muscle hurts here and it hurts to touch. So those are kind of two different things, but they're very related also.
So you have a mouth guard, then you have a retainer. A retainer is to prevent the teeth from getting any worse, to keep them in the position that they're in. Even if they're not where you want them, it gives you a chance to put together your guts and some money to where you could get an Invisalign type product.
Yeah. Invisalign also provides you can do a scan and you can just make a retainer. You don't have to do Invisalign and move the teeth. So we've advised some people to where they're not in the position to do Invisalign yet, but they can afford a couple $100 retainer that'll hold their teeth in that position for many years till they're in a better situation and they can actually do Invisalign. So,
and you've been in dentistry here in Miami for a long time, for 25 or 30 years?
35 years.
35 years.
Yeah.
Is there anything particular to dental health here as compared to other parts of the country? Anything in particular that's different?
Not really. Not with the climate or anything else. I mean, we're a big metropolitan, city, and there's a lot of stress, a lot of business, and we do see a lot of people. Stress is a definite cause of the grinding too. A lot of people will show their stress at night when they're grinding. So we do see a lot of that, but not more than probably California or New York or anywhere else.
So what are some basic things people need to do to have a good dental hygiene?
Regular visits is an important one. Coming in, we recommend doing x-rays every year just for the bite wing, the checkup x-rays. And then we do full mouth series every 3 to 5 years, depending on how much work you have in your mouth. So a lot of things, we've had some people who they don't like the radiation, from the x-rays, and we can understand that, but there's been digital x-rays out now that have basically over 90% less radiation than back in the old days when you would take films and develop the films and everything else. And it's a sensor that is hooked to a computer. So the radiation level's so much less, than it used to be. So that kind of helps with a lot of people who have that fear. But we had one lady, for instance, a couple years ago, and she kept saying she doesn't want to take x-rays. She doesn't want to take x-rays. And we try to recommend to them as softly as we can, but there's a point to where we're not doing our job, and if they're our patient, we're held liable for anything that can happen. And basically, you just have to have a heart-to-heart and say, look, you need to do x-rays, or I'm going to have to dismiss you from the practice because I'm not providing you the standard of care that I should. And she gave in, and she says, okay, I'll do one set of x-rays. I haven't done one in 10 years. I'll do one. And in the set of x-rays, we found in the bone on 3 of her front teeth that she needed 3 root canals. She had 3 infected teeth that were asymptomatic, but the infection was in her bone and eating her bone around her teeth, where she would have lost 3 of the teeth. Afterwards, she was a committed to x-ray person, and that's every time she could.
And that's because it's underneath the surface and you don't see it.
It was underneath the surface. It was in the bone. There's all kinds of things that you can see. Root canal. She needed 3 root canals. They did it, and her teeth healed up perfectly.
So regular visits.
Regular visits, regular cleanings, because like I said, you can clean your teeth at home, but you can't get with the tools that we have, some of the stuff. Healthy diet.
Okay.
Healthy lifestyle.
And what about dental floss?
Dental floss is so important because I always tell people, they always tell me that they use the water pick. And they go, I don't floss, I use the water pick. And they'll come in and their gums are still bleeding. So I always give them the old story that if you're in a Jeep and you're 4-wheeling in the mud and you come back and you get a hose and you hose your Jeep off, it looks like it's clean. But if you walk up to it and you rub your hand on it, you're going to have a film of dirt that's on there. And if you take, cloths and you get it cleaned and they clean it and scrub it, you take your finger and it's perfectly clean on your hand. Same thing in your mouth. The water pick will get a lot of the debris off, but it won't get that surface plaque that sticks to your teeth off.
And some people think that dental floss in itself is enough. Here's what I found, just me.
Sure.
I use dental floss first, and I think I got it all. Then I use the water pick, and I go, look at all this stuff that the dental floss didn't get.
Yeah.
So for me, it's twice that.
Yeah, depending on your teeth, you know.
And so lots of people have gum disease, right? And lots of people don't. But one of the signs of it is what?
Bleeding is probably the biggest one. You can bleed when you floss your teeth or brush your teeth. And there was a survey that went out and to people, and they said, is it normal that your gums bleed when you brush or floss your teeth? And 50% of the survey from this marketing company, this health marketing company, said that they said it's normal. So 50% of people think it's normal that your gums bleed when you floss or brush, which is so far from the truth, but
And people say, well, what's the harm that they're bleeding? And so the answer to them is, that you would give them, what's the bleeding significant of?
The bleeding is inflammation again, and the inflammation is the plaque that's left in your mouth is full of bacteria. Back in the day, like 50 years ago, they used to do this thing to where they had a microscope in I wish they would bring it back. It probably would open a lot of people's eyes. They would have a microscope in the dental office. And the old school people, some people that I used to work for years and years and years ago, they would take a little piece of the plaque, they would put it on a slide, put it on the microscope, and have the patient come and look at what they just got out of their mouth. And you see amoebas and you see, little microorganisms running around, different shapes and sizes and all that. Live bacteria, like different types, hundreds of different types. And they would open their eyes and they would become converts and they would clean their teeth like immediately. Yeah. So.
And we got a couple minutes left, but let's talk about in your office, somebody could walk in if they need to get a cap. Tell us about it. From the time they walk in, they're there, they're doing some work, and they go, okay, patient you need some work done, and they walk in, when could they get a new cap? How long does that take?
Okay, generally, I would say about 80% of the caps or the porcelain crowns
Yep.
that we do in our office, we make in-house. And in-house meaning we have a scanner that scans the 3D shape of their tooth, and we design, say they broke a tooth, we scan it and we design it back to the normal shape that it should be, cosmetically and functionally, with the bite and the contacts and the shape of the teeth and the color. And we have a milling machine in the office that takes a block of porcelain, and usually between 10 and 12 minutes, something like that, maybe 8 to 12 minutes, depending on the size of the tooth, it will mill a crown, and I take the crown and we put it in. So usually a 2-hour visit from start to finish, and they leave with a permanent crown in their mouth.
2 hours.
2 hours, yeah. It's called CEREC.
And one of the things about that device, the way it works, it takes off the block the stuff that it doesn't need.
Correct.
Which is an interesting way. It's not building it, it's taking off the
Yeah.
stuff it knows what it needs to do. So this is a 3D machine. It's a wand that goes in your mouth. You look at it, you look, see how it looks. All right. You pick the corresponding color to make sure it matches. You put it in this, and it's water driven.
Yeah. The water cools and rinses out the debris from the diamond. There's 2 diamond burrs that work on either side of the block, and they form it as it goes along. And then it cuts a little edge of it off. It's called the sprue that sticks off. And you take it, we polish it in the lab, then we polish it chairside, adjust the bite, and put it with permanent cement that visit.
So, and for that, you don't need to do the gooey stuff that we used to use and send it off to the lab. You don't have to do
no.
that, which
God.
usually a week to 2 weeks, which means another visit to the doctor.
Yeah,
Right.
the week to 2 weeks has now honestly turned into 2 to 3 weeks, sometimes longer, because lab people, they get very busy. You know, you got a good lab, and you don't want to use a bad lab, because then it's just you're redoing the case. So
Yeah.
we use a really good lab, and the really good labs are popular. So they take vacations. They have problems with ordering stuff, everything else. So having that hour to 2 hour turnaround time in your office is key. So
Can we put up the QR code? When it goes up, there it is. There you go.
Right there.
Oh my God.
QR
there
code.
It is. There
Right there.
it is. The
Yeah.
QR code. All right. So people can go there, they take a shot of that, they go right to your website. Can we put up the website address also, Michelle? And people can go there, they see your very friendly staff that's over there.
yeah.
And again, you're right off of US 1 in Lejeune, 1 block from there.
Yes.
Right? And
We're on Lejeune, yeah, and US 1, and then we have a parking lot in the back for the Gables, which is great. We have 45 spots.
That's a big deal.
It is a big deal, because in like downtown Gables, I know it's very difficult
And
to
it's
park.
and it's free parking.
It's free parking. Yep, yeah, exactly. And there's overflow on the streets that you do have to pay, but after 45 spots. So yeah.
And so you're a cyclist.
Yes.
So
yes.
tell us about that hobby of yours.
Yeah, I've been biking for a long time. I got into triathlons after dental school. I used to live on Key Biscayne for 17 years. So it's a great place to bike. They have bike lanes, they're painted green, usually ride in groups for you're very visible. We've ridden with different groups for years and years and years. And then about 5 years ago, 6 or 7 years ago, I moved back to Coral Gables, a little closer to the office. And I bike with this great group, CCG, Cycling Council Group, funny name, but great group of people. And we leave out of Ponce Middle School, and we ride to the Redlands, and we ride back. And it's very safe, because at 7 in the morning on Saturday, there's not a lot of people.
How many in your group typically?
We have about 40 to 50 members, and usually we'll have 20 people that ride. So it's a good visibility, good group to go.
And so when you leave the Ponce, you go down the Redlands, you come back. How many miles is that? More or less.
Sometimes we ride 52, sometimes we ride 67, depending on the day, how hot it is.
And how long does that take for your
We do stop when we get down there, and we get coffee and some bread, and we drink our little goo or gel or energy bars and all that stuff, and then and rest for about 30 minutes and then come back. So round trips like 3.5 hours, and we usually try to shoot for 18 point something miles per hour average. So, which is a good clip.
Yes,
Yeah.
and there's an advantage of being in a big group.
100%.
So that the cars see you, all right, and you see the cars, all right, and so that's great. And what's the split in men and women in that group?
We have, sometimes it's 30% women, sometimes there's 3 women, you know, it doesn't matter, but it's a great group. And the ladies in the group are strong riders. Yeah,
And
they're good.
athletes.
Yeah, oh, big time. Some triathletes in there as well.
And typically, what time do you leave?
Normally about 7 o'clock, but it depends on the time of year when the daylight savings change and all that. If it's too dark, we don't like to go in the dark, especially me. So I always push it back to 7:30. You know, the group will go in 7:30 if it's that. You know, so. And
I appreciate your friendship for all these years,
oh,
Doctor.
Thank you.
And if people need to reach you, they can go to your website. They can call you, make an appointment, and you can show them all the different things that we can do, and they can check out your teeth. And I wish you a very happy New Year and
Thank you so
lots
much.
of smiles for you. And
Yeah, thanks for having me. This is a great opportunity, and appreciate it.
Thank you so much. Folks, thank you for joining us, and remember, take care of yourselves and your family. Have a great day. Bye now.